Experts take the couch, the living room on 938 Live.
Well, thank you for staying with us, Stanley Leong and myself, Pamela Ho, and you're tuned to the Living Room on 938 Live. Well, we continue the conversation with our expert on the couch today, and he is Dr. Kevin Lau, and he's a chiropractor as well as a nutritionist practicing at Orchard Clinic. And we are finding out more about the treatment of scoliosis, which is a condition that affects the curvature of the spine. But more so, we are exploring a non-surgical method of treatment, and this is part of a treatment that is mentioned in his book called Health in Your Hands, Your Plan for Natural Scoliosis Prevention and Treatment. And of course, we'll be finding out a little bit more about that book in just a while. But we do have some more questions for Dr. Lau with regards to the anatomy of the spine.
That's right. Is your spine an S or a C? Well, that's something I just picked up during our news break. That, you know, the natural posture or alignment of the spine, if you like, takes on either the slight form of an S, the letter S, or C. I didn't know about the C until now.
Yeah, it sounds like a very hunched sort of a posture, doesn't it, a C?
Doesn't sound good then. Time now to find out more from Dr. Lau about the anatomy of the spine. Tell us more about the variations there. What's
Okay,
natural?
when it comes to a normal spine, when you're looking from the behind, the spine should look quite straight. There is a minor amount of deviation between everyone. But for someone that's scoliosis, it can come in two different types of variations. It can be in an S curve or a C curve. I've actually seen curves that are 3 curves or 3 S's or 4 S's. So within those deviations, there are minor changes.
And how would you know that those curves are normal or it's not normal? I mean, how would you, kind of decide?
Well, definitively, I think most of the time it's just through x-rays and getting that Cobb angle that we discussed about before.
Right, and talking about forms of treatment, I mean, for most chiropractor, we were just discussing earlier, either embracing the more serious cases, you actually have to go for a spinal surgery. But, as a chiropractor and a nutritionist, I mean, how do you tackle scoliosis that is different, let's say, from the other Western sorts of medical treatments?
Okay, well, conventional sort of medicine tends to tackle on disease in philosophy through intervention. Whereas as a chiropractor and a nutritionist, I'll primarily work on the health of a person and making sure that the spine is growing properly. So it's kind of a roundabout way to try to improve the quality of health of that spine.
And when we're talking about the spine, of course, we're talking about bones as well. Does protein figure largely in the way that the sort of advice and recommendations you would advise patients, protein intake and all?
I think protein is especially an important aspect, especially when it comes to adolescents or young girls going through a lot of menses and they're going through a lot of changes in their body. They actually need a lot of calcium and iron and other things that are helpful to support the growth of their spine. Which is also delved into the book in more detail.
Right. But, looking at, taking a step back, I mean, how did you first even get inspired to research on scoliosis and the natural sort of methods of treating it?
Well, through research, I've realized that this concept of natural sort of treatments isn't a new concept at all. Throughout the world, in America, in Germany, in Israel, there have been programs and methods out there that has been documented to help people with scoliosis. I've discovered that a lot of people in Singapore was feeling quite hopeless or disempowered whenever they were diagnosed as having scoliosis or waiting for surgery to eventually come. So they didn't really have a method or any sort of direction. So the book came about as a way to just enlighten people and also give the power back to people that there is a bit of a hope out there. Through my research, I've actually gone through and I've discovered through the different methods and taken bits and pieces and I've kind of compiled it into this book. And this is the same sort of method that I use on a regular basis in my practice.
And do you perhaps draw also examples from the different clients that you have also treated through the many years that you've been practicing,
Yes.
and also putting them into the book?
Yes, there's heaps of testimonials and also case studies, so then people can understand other people who have gone through the same sort of condition. There are young kids that have gone through this sort of program thinking that they had to do surgery, and then they were they could avoid it at the end of the program. There are also 40-year-old ladies that certainly surgery for them isn't an option, so they want to do something about it before it gets to the stage where it starts affecting their quality of life.
Mm. And you're definitely one of the most experienced in non-surgical scoliosis correction in Singapore. I mean, you have seen hundreds of patients, and I think one of our main local newspapers have also identified you as a leading practitioner, given you an award for that as well. Now tell us a little bit about what happens when a patient comes to you, comes to the clinic to see you. What do you actually put your patient through? What is the procedure like?
Well, most patients go through a series of taking x-rays initially, so then we can see what degree they are beforehand. And then over a course of a few months, 3 to 6 months, depending on how severe the curve is, they go through a series of exercises, medical equipment, as well as chiropractic treatments with me. Nutritional advice is also given out each session, so it tends to be quite holistic in its approach.
How many sessions would one be required to attend?
Oh, depending on the severity of the curve, if it's a moderate curve, we're looking at about 6 months, where they come in twice a week.
Okay. Well, in the living room today, we're hearing from Dr. Kevin Lau, who is chiropractor and a nutritionist and practicing at Orchard Clinic. The clinic is located at Rolex Centre on Orchard Road, downtown. In fact, if you'd like to find out more about scoliosis as well, they do have a website, and a very convenient one to remember as well.
Yeah, that's right. Well, the website is www.scoliosis.com.sg. Scoliosis.com.sg, of course, spelled SCOLIOSIS.
That's right. And you know what, Pam and I, both of us, of course, being Chinese, we and the Malays, Chinese and Malays apparently are twice the Indians more susceptible to actually becoming...
Yeah, and women more than men. So.
Yes. Being affected by scoliosis. So Pam, you're two up from me then. No, you're one up from me, but we're two up. Anyhow.
Yeah, that's right.
I'm just wondering why. Is it the diet? Is it... I don't know.
Yeah,
Is there any reason for this as to why certain races are more susceptible to scoliosis?
Races, yeah.
I mean, certainly diet, I think, is a big part when it comes to scoliosis. That's quite controversial. Within the book, I do delve in much more in detail in terms of why I think diet is a big part of scoliosis.
Yeah, and in your book, you describe, well, the resilient health of primitive cultures living off a traditional diet. Now, but how are traditional diets of primitive cultures relevant to today's modern society? Because, we are definitely bombarded with lots of processed foods and fast foods and stuff like that.
Oh, definitely. And I think most of the basis of my sort of research was actually through a dentist in New York who in 1920s went around the world and studied primitive cultures and discovered that they were pretty much resilient from most degenerative sort of diseases. What he found was healthy, well-formed, structured people with good mental sort of capacity and emotions. And then what he found was one generation after they were introduced with a more modern sort of Western diet with processed food and fast food, they started getting cavities and crooked teeth and deformities and suffered from a lot more of the degeneration that we tend to see in modern life.
Mm-hmm. Well, that's scary. A lot of illnesses come because of the foods. We don't even realize it, actually, when we think about that. Yeah, and of course we are talking with Dr. Kevin Lau, and he is a chiropractor as well as a nutritionist, which is quite a unique combination because he's able to give us a very unique perspective on treating scoliosis, which is a natural sort of treatment that doesn't involve inserting rods as well as, surgery. Now, when we talk about, when the people who come and see you, I mean, I would really love to hear some real-life stories of patients who have come to see you, and because of certain diets that you've prescribed to them, that you have actually seen, them improve because of that.
Yes, definitely. In the first chapter of the book, it actually highlights a patient of mine who has actually been with me for about 5 years. When she first came to see me, it was primarily just a back or spinal issue. And then over the course of just changing her diet and also improving her lifestyle habits, we're actually able to reduce most of her medications. She went down from 12 different types of medications, from high blood pressure, diabetes, to cholesterol issues. and it all reduced over a period of a couple of years. And even to this day, she's still reporting back to me and telling me that most of her medications is still reducing.
What about the curvature of the spine then? Has that also improved?
Yes, that improved already. But that was the initial stage.
Right.
So like I highlighted before, my main emphasis is just really focusing on improving the health of the person and then letting the body heal itself.
Would it mean then a whole change in the sort of foods that one is supposed to be taking in terms of even spending more money, perhaps buying, I don't know, organic food or stuff, more expensive food stuff?
Not necessarily. I think, especially here in Singapore, organic foods tend to be very restrictive. It's not easily accessible. I think if people just do the simple switch from processed foods to more whole-based foods, foods that actually spoil when you keep it out for a bit of time, those tend to be a lot more nutritious.
I never thought about that. Foods that spoil, the more, the quicker they spoil, the more nutritious they are.
Oh, definitely.
Is that so?
I mean, most foods these days that are processed, they're processed primarily just to improve shelf life.
Yeah.
And to prevent wastage. So through these processing, unfortunately, due to modernization, they do tend to lose a lot of nutrients.
Right. So traditional whole foods would be foods that kind of look like they do in real life. Somebody told me that, like a chicken looks like a chicken, but, a fish ball you don't see a fish ball in nature.
Right.
So it's processed. I don't know how to define it other than that.
I don't know about fish balls. We're putting a pause on this and we will fish for more answers with our guest today in the living room, Dr. Kevin Lau, who is a chiropractor and nutritionist from Orchard Clinic. The living room will continue in just a bit. Stay tuned.